So other ways of treating depression, electroshock therapy is still being used. It's being used less nowadays that we have the possibility of using these reuptake blockers. But there are still patients who do not respond to the treatment and who are suicidal, and therefore they receive electroshock therapy. It is the most efficient therapy that we have, period. It's not only the most efficient for treatment of depression, it is in general the most efficient therapy that we have available. So it would be strange if we decided not to use it because it's also having relatively low side effects. And I say relatively, it does have side effects, but it's relatively low. And as long as it's being used for people who are really suicidal to get them out of that suicidal phase, everybody in psychiatry agree that this is a treatment that we cannot abandon. Even though we don't know why it works and what it's actually doing, but it's some kind of a resetting of the brain which makes it work again afterwards. No idea how it works. It is kind of an unpleasant way of treating people, granted. You have to have full anesthesia when doing it, and it is high voltage that is being used, so it is a generalized seizure of the brain which is being induced. So it is dramatic, but the depression that these people have is also dramatic, and therefore it's necessary to do these things. But otherwise, it's the main way of treating depression is the serotonin reuptake blockers. Now, the other drugs are hardly being used anymore. It's only if people don't respond to the serotonin reuptake blockers. Lithium is being used for bipolar disorder, and only for bipolar disorder. It has no effect on unipolar depression. It has no effect on unipolar manic disorder, but quite efficiently levels out these fluctuations in mood that are being seen in subjects with the bipolar disease. Again, we have no good explanation why it works.